Hello everyone. So from today we are starting a series of videos on obstetrics, and today I will be talking about some the important topic, that is hemorrhage in early pregnancy. It's some of these causes, and from next video we will be talking in detail about the three main important causes of hemorrhage in early pregnancy, that is abortion, ectopic pregnancy, and gestational trophoblastic disease. So let's see what are the causes of hemorrhage in early pregnancy. Uh, the causes of bleeding in early pregnancy can be broadly divided into two groups, that is those related to pregnant state and those associated with pregnancy state. And those related with pregnancy state are abortion in 95% case, the ectopic pregnancy, the hydra-deform mole, and the implantation bleeding. And we will be talking about these three in detail in from next video. And other those who are associated with pregnant state are, these are not actually related to pregnancy, but these are gynecological problem, and these maybe might cause hemorrhage in early pregnancy. And some of these are cervical lesions like ectopy, vascular ectopy, that is erosion, polyp, and ruptured varicose vein, and the malignancy. They are important cause. These gynecological lesion in relation to pregnancy are will be discussed in our gynecology picture. In soon I will be uploading that about this topic in another video. So first of all, talking about abortion, the definition of abortion varies from one source to another and even country to country. This has some legal definition also, and WHO has also given the definition. Usually the abortion is defined as spontaneous or induced termination of pregnancy before the fetal viability. So the term abortion is used for intended pregnancy termination, and the word miscarriage is used for the spontaneous loss. This is intentional and this is miscarriage. This is spontaneous loss. And the medical termination of pregnancy, MTP, means describes the termination of live embryo or fetus by either medical or surgical method that has not reached the period of viability or weighing less than 500 gram according to WHO. So that was about medical termination of pregnancy. And from next video we will be talking about spontaneous abortion in detail. Till then, thank you, and let's see in the we will meet again in next video. Thank you.